And I want to state that in Kirinyaga County, we have been really supported by the county government, that is through Her Excellency, the Governor, Madam Anne Waiguru, to improve in terms of maternal and reproductive health and even child health. And one very important thing I want to mention is that issues to do with maternal health, say maternal deaths in Kirinyaga County, we have tremendously reduced from over 100 per thousand live births to around 50 to 70 per 100,000. One very important thing is to mention is that the support has been great, because in Kirinyaga County we have been able to do the new status of the art maternity in our county referral hospital. And number two, equipments have already been put in place in case of the newborn unit, whereby after the children are born, that's where they are being taken care of. We have been able to come to these levels also due to the type of trainings that we have been doing to our healthcare healthcare workers, that is the nurses and doctors and all the others who have been involved in taking care of pregnant mothers until they deliver. It has also been great in our county, because the pregnant mothers have been able to come for the 4th ANC in the that is antenatal clinic in our facilities, up to a level of over 80%, and therefore there is great improvement from the previous performance, meaning that going that way, and now that we have already received our CHPs and we have received the kits that as a county we have already been able to distribute to our community health promoters, it means that we shall continue improving, because they will take up the responsibility of following up our children at home, so that we are in a position of knowing and causing the mothers to come right in time. I may also attribute the improvement to the support from the national government that has been there in terms of Leader Mama, that so many women and pregnant women have been encouraged to come for safe delivery, that is a skilled delivery in our hospitals, because payments and reimbursements from NHIF have been happening and they have been supported by the government, something that we are really happy about and wishing that it should continue, even with the new bills and in the new dispensation where we are talking of social health insurance, that this may continue supporting our mothers. So therefore, the bottom line, I want to thank Her Excellency the Governor, Madam Anne Waiguru, because of the support that she has shown to the Department of Health. And we are really grateful, because with that kind of support, it's the reason why we are really happy to see that we have improved in terms of maternal health. I also want to say that we are also developing Kirinyaga Hospital and Kimbembe Hospital. Those are sub-county hospitals that are going to be new status of the art hospitals, that we are also having maternity wings and other services being delivered in those particular facilities. In the same breath, I want to thank the collaboration between the national government and the Kirinyaga County government, and rather with all the other particular governments, that is sub-national governments, in that in the same line of supporting our pregnant mothers or maternal health. I want to state that we are so grateful and happy because of the introduction of M-Mama services that we are going to introduce to the communities, so that any pregnant woman would be surveilled wherever she is, so that anytime there is an emergency, that mother can call a certain number which is toll-free, so that she can be known where she is. If there is a distress call, that we can be in a position to pick her. And the system would be such that there will be certain taxis within the localities of all the locations, so that the nearest taxi would be engaged to pick that particular pregnant woman. And during the transportation, there will be communication to the nearest health facility where the referral is going to be happening. So much so that even the facility that's gonna, the patient or the pregnant mother will be referred to, will be ready to receive that particular pregnant mother with all the details of the expectation on what they need to do to that particular mother. It's a very good system whereby a call center will be established, and within this particular call center is whereby our healthcare workers would be referring or would be identifying which particular taxi is nearer where, so that a certain mother who needs a particular service is helped in time.